Hello, everybody. I'm very happy to be today here with you at Happy. It's been 3 or 4 years ago when I met Henry for the first time. It was at the Beyond Budgeting conference on the other side of Thames. And I was thinking I changed job in the meantime. I moved office building several times. I moved my desk several times. And what has followed me is this small blue book, The Happy Manifesto. It really made an impression on me. So you are today learning here about Beyond Budgeting, and I'm learning about how to arrange workshops and how to run the training in a very efficient way. So, as Henry mentioned, I work for Leo Pharma today, which is Danish pharmaceutical company specializing within dermatology. And I would rather represent the Coloplast case to you today because it's a more mature case. We've been running Beyond Budgeting at Coloplast for 8 years, so I have more to tell you. And the Coloplast story is really a great story. It is about a company who has faced challenges and who has understood the need to change. Coloplast has focused on empowerment and ability to adapt. The board appointed a new leadership team and very lean executive team. We got Lars Rasmussen as our CEO, and we got Lene Skole as our CFO. And they did the turnaround, and they did the job over the upcoming 6 years after 2008. So it was a different leadership style, different leadership approach. We suddenly experienced straight talk, fast decisions. We started looking into performance into different way, and we have started with simplification of our organization. Basically, it was a journey. We embarked on the journey which has changed Coloplast of being a small regional player to become a truly global company. And as a response to the challenges we have faced, they have rather quickly defined what needs to be done on targets. So we have set our focus on profitability. So growth, yes, but the growth needs to be profitable, and we need to have a more balanced approach. Direction, there was developed a new strategy for the company, which was kept only at corporate level and rolled down to disease, as you recall, ostomy, continence, and wound care, and nothing below. And what was introduced was Coloplast Agenda. That was a kind of short-term focus. What are our priorities for this year or a year and a half? And this agenda was communicated frequently at all employee meetings once per quarter. And effectiveness, yes, we did quite a lot of cost cutting over the coming years.
Could you talk to what enabled you to do faster decision making?
Faster decision making.
It was listed as one of the things that changed or was done differently. What enabled the faster decision making?
The organization has become more lean. It has become more flat. You did not have that many layers. Not from day one, but that was what we have experienced. If you look full value chain in manufacturing, R&D, marketing, and sales. So an example could be, shall I talk louder? Yes, an example could be our affiliates. Earlier you had a head of an affiliate where he had 8, 9 direct reportees, and that was changed. So the head of affiliate has become either the head of sales or head of marketing, and all support functions were gathered under business support. So he had 2 or 3 reportees going forward. So the decision was, so that enabled him to focus more on the business. rather than to administrate all the requests from corporate. That is only one example. So, and that was the time where we have discovered that the traditional budgeting did not support us on this journey. So could you spend a minute in your group and tell me why the traditional budgeting does not work? You must have an experience. I don't know if you are finance people, but everybody comes in connection with budgets in your daily work. Input I got so far was that the budgets are outdated and that it's just a guess. And the guess we are spending a lot of resources on, I would say. Well, what we have identified at that time as rational, that it was that budgets were driving wrong behavior. You know this use it or lose it mentality. When you are approaching the year end, November, December, you spend 3 times more than in the beginning of the year, of course, because you need to secure your baseline, and preferably you should also negotiate some additional resources. Another thing, budgets are often prepared for a single department or a function, so that makes it disconnected of strategy, and this drives a lot of sub-optimization. Third thing, you said it takes a very long time, and a lot of resources are put in such a process. 2, 3, sometimes 4 months. Not only finance people, but all leadership is involved in this exercise. And when you think of the resources put in it and the value at the end, it does not balance. And the last thing, budgets are outdated. Yes, you know all these iterations, the version 12, 13, 14, finally it's approved, let us submit it in our system, and what happens, we make an organizational change in our marketing function, and what you can see in front of you is that you have a year where you will do the variance explanation because of the phasing. So, one number cannot do the job. It's back to what Anders showed to you this morning. There were a lot of different and conflicting purposes with budgets. And that's what we have tried to define in a new performance model when we decided to skip the budgets and introduce the new model for our organization. So we said we will work with setting high ambitions, aspirations, where we will look into the future 3 to 5 years from now. We will establish a rolling forecast. It is high-level rolling forecast. So forecast is not prepared at the department level. It's prepared at functional level. And it's updated once per quarter, and we decided to look 5 quarters in the future, just to come above this frame called financial or calendar year. Another thing we worked with was opening for resource allocation, make it more flexible, on demand, after the needs, where you have opportunity, not the way that bank opens once a year. And the last element is where we have tried to adjust our bonus model, because we had a bonus model where we were spending a lot of time on defining different individual bonus goals. And what we have done there is that we have introduced relative targets rather than fixed numbers, and that we started working with ranges. But we were not able to skip completely bonus scheme. It was relative internal, because, you know, I was discussing with one of my table mates this morning, what does it mean having fixed target and trying to make it relative? Fixed target, you are supposed to sell for a certain amount, and you can reach that, and then you can lay back. or you can see in the middle of the year that it will not be possible because there are some external factors, and then you lay back early in the middle of the year and wait for the next year. And when we are defining these fixed targets, we don't know how the world will look like, because the world is changing with much faster pace today than it used to. So look at the share price development. You say it has grown 5% over the last 6 months. Not bad. But what if the market in that industry has grown 10 or 15%? Then we are behind. So we have incorporated in-market sales in our major and mature market where that was possible. Emerging market, it was a bit difficult because we did not have data. But you can make your target relative by thinking what is the delta you are making. It does not have to be comparing to the rest of the world. So there are many good examples. And then you could say if it's working, yes, it has really shown great results on all parameters. So after 5-6 years, we started outperforming our peers on financial performance. Our shareholders were happy again. We got motivated and engaged employees. About the average, I would say employees and customers that are the most important factors, because that is something which will secure your future. And if you look at what does our users, patients tell about us, there has been a number of years in a row where they have chosen Coloplast as the best medical device company on a number of different parameters, like product solution, customer service, etc., etc. So it works. And when we talk about ambitions, it was not just to stop there. They still have an idea of growing more, say growth between 7 and 9%. And I don't know if you have noticed, it's not a growth of 7%. We work with ranges. We don't know how it will develop. I can tell you that it's quite ambitious, because the global market was estimated to grow between 3 and 4%. And then if you look at the profitability, still improving profitability by 50 to 100 basis points a year. And when you work with these ambitions, how do you get people to relate to this, how they can understand how they can contribute to this overall goal? So what we have used is, we call it Coloplast Agenda. It was a kind of framework about the activities or initiatives which were in focus in short term. And it was structured around growth, profitability, and people. And we were all supposed to recognize ourselves on one of those initiatives. If we were working in manufacturing in Zhuhai, in China, if we were sales rep in Buenos Aires, or me sitting at headquarters in finance in Denmark. And it helped a lot. This was one of our main communication tools. So, working with ambitions, this is something which has characterized work at Coloplast a lot. Ask for the impossible. You will not get the impossible, but you will get something which is close to that. And what does mean ambition or aspiration? It means that you do not get targeted your ambition as a function or a region. You are asked to go and define your ambition self. Where do you see yourself in the future? And you need to have an idea which actions, which initiatives will bring you there. It's not 3 or 5 year budget plan where you know exactly where you are in year 3 or 4 from now on, but you need to know that the things you are doing are the right things and that they will bring you to the ambition you define. We made a mistake the first year we started working with this. We asked the organization to come and present their ambitions at the same period of year where they usually presented budgets. And what we did, which was even worse, we have consolidated everything like we do in finance. And that was not the idea. The idea is to give the ownership for the ambitions to the business, to discuss this at business reviews, look at your performance, how you are performing. Rolling forecast is a very important tool which is helping to close the gap to ambitions. It helps you, are you on the right way? Ambition or aspiration long term, it is meant to be defined at rather high level. If you have function, it's not meant that each and every department has ambition underneath. If you look at the company, now at Leo Pharma we have patients, number of patients you would like to reach, we have people engagement, and the last one is financial performance. And if you look at the regions or R&D function, so everybody needs to kind of link in with their KPIs. And it is really difficult. But it makes a lot of sense to keep it to very few but relevant KPIs. Otherwise, you drown in it. Review meetings are the regular quarterly review meetings. And this is something we also has changed, where we did not any longer focus that much on pure financial KPIs. And a region or a function, they prepare the agenda for the business review. It was not like only reporting to corporate. It was about what are our risks, what we are dealing with, and do we have any opportunities. It was more like business review, not financial review. All right, now I have a couple of examples of what could be an ambition for a function like finance. At that time, we started working with this concept. We had a global finance cost ratio to revenue of 2.3%. And if we compare to all companies, best in class, world class, they had a ratio of 1%. So the ambition was set that we should go down to 0.75%. And what we did do, we implemented the standard ERP solution. We standardized, automated our reporting. We established a shared service center in Poland, a number of things. And when I left the company, the ratio was around 1%. So it has significantly decreased. Whether they will ever reach 0.75%, I don't know. It doesn't matter. It's not linked. It's not bonus target. It's not. But it's just setting the direction. Back to examples for ambitions. There is one example of non-financial ambition. It was from our Belgian subsidiary, where they aimed in getting 2 out of 3 NPDs. That was relevant KPI in medical device industry. It was in Coloplast world. It was 2 out of 3 newly discharged patients leaving the hospital with Coloplast product, because the probability they would keep using the same product the rest of their life was rather high. An example for regional ambition. At that time, I worked with Region Europe, and that were very mature markets where we have been for more than 50 years. So we had very high market shares. So we were not expected to grow double digit. It was not possible. So the ambition was defined to grow above the market growth and to still think of this growth and make it profitable. And the last but not least, the ambition for the company was to become the best medical device company. And you have seen that there are different parameters to measure this success about being the best medical device company. Yes, and if you look at the journey where we started here in 2008, if you look at the focus we have put on profitability. The blue line, turquoise line, is the EBIT margin. We have already in 10-11 doubled our EBIT margin from 8, and you could say that's great, and it was indeed really a good thing. But if we compare to our peers, we were still far away. So it continued, and you can see the profitability has tripled. And in these years, the focus was very much on cost containment profitability. And it was here in 12-13 when we started with investment to the growth initiatives, and it was quite a shift for the organization to change this focus. Now there has been 4 or 5 years where they were asked to think about their costs, and now suddenly we have a certain amount of money we would like to invest in sales initiatives. And it went 6 months, 1 year before they understood that the bank was open, that they could come with a proposal. And there were jokes in the organization: the bank is open, but the cash machine is broken. That's what was experienced from the years where we have worked with profitability. So the resource allocation, it's not only about getting approval for the big investments, billion investments. It is also for the lowest level. You don't have forecast, you don't have plan, you don't know how much to spend. So you need to think of not any long, you don't have budget scheme. Is there any money left? Can I attend the conference today? It's more, is this the right thing to do? And it has been a huge mindset change, especially for middle managers. They felt a kind of naked without budgets. So we said, go and spend for what you think you need to spend on, and we are monitoring the cost development, not comparing to forecast, but to previous years. And you would need to justify for your spending if you asked. But when we talk about the mindset, I would say that there was a group of people, like 25% of our organization. They just waited. That they could really see the meaning with this new model. And then we had another 50%, which has embraced the change, but they had difficulties. They had to work on it to understand how it works, but they managed. And today they think it has been a good idea. And then we had the last 25% who never managed to adapt and who left. Prioritization, what I said, yes, the bank is open, but you need to have the big picture when you are allocating your money. And that's quite important. That's what we have tried this with emerging markets. So the mindset change, defining the tools and the structure of the new performance model is one thing. Making it work, getting people understand their role, which kind of behavior is expected from them, like leader, is another thing. So now I have some travel statements where we were moving from, where we were coming from, where we were moving to. This is something which we have used for workshops we have run with our colleagues from HR. We were moving from 1-year target to long-term ambitions. It is also kind of summary now. We were moving from upfront allocation once per year in budget exercise to this concept: the bank is open 24 hours a day. You don't have to wait until September next year. Come with your proposal now. Instead of doing things in the same way, think in a different way, adapt. Instead of command and control, to empowerment, which we have talked so much about today. And what is behind this? There are some 4 simple but very strong leadership principles, and they have not changed since I left the Coloplast. It's the ambitions, what I have, and challenging your team. That is the mantra of our CEO. It is visible and decisive leadership, not physically visible now when we are working globally, but that you know with your behavior as leadership that you are clear in the way you are communicating, that you are what you expect from your team. Open and honest about your performance even when you are facing challenges. Don't hide it away. There is a problem. What is the magnitude of the problem? What you are doing about problem? Let us liaise about that. And then focus on the business results and enhance team performance. So, the last thing, your questions went very much about this, how did the finance deal with this change? From my perspective, I can say that my job made much more sense than it used to. It is not easy to be a finance guy or lady and to come and say, now we are not preparing budgets, you can spend as much as you need. So it requires some different capabilities and different profile from finance. But what I can say, it was moving from detailed planning, from systems and reconciliations, and opening, releasing more time to have the overview, the big picture, come closer to the business, take the right discussions, and come with some better proposals. Back from backward-looking performance, now we are talking about are we in index 104.25 comparing to budget? It doesn't really matter. Are we growing comparing to the last year? Are we decreasing our cost? What is behind this? And it's more when we had a rule that we should spend on our meetings 1/3 on how we are doing on actual performance and 2/3 on the future. So, lessons learned. What was really important in this change? That we were very privileged at Coloplast that we had 100% support of our management behind us. They really wanted this and they walked the talk. At the time we were considering whether we should start with implementation or not. Decision was made that we should be brave and jump into it, well knowing that there might appear a number of questions we did not have an answer on. So it was learning by doing. When you don't plan at that detail level, it's very important that you have a high quality of your actual data. So if you have a solid ERP platform that you know, it's a prerequisite, I would say. Mindset change, HR, that's something we have already talked about. We could have involved our colleagues from HR some years earlier. We would have done much better. Why HR? Because it's such a big change to understand, to help people to understand what is expected from them. And it's not just a new financial planning model. It is very linked to the leadership principles. So it's more to help us to get aligned across. It's not working in silos like functions. It's us in finance and HR, but going together into the organization. And what we have experienced in latest stage was that we arranged some workshops on leadership and beyond budgeting. And that was very well received. I hope you liked it. I hope you found it interesting. Any questions?